Good evening, everyone. I am Dr. Smita Jain Singh from Chandray Rheumatology and Immunology Center, Bangalore. Today, I will make you more aware about the most commonest topic, allergy. What is this allergy? Allergy is a hypersensitive reaction initiated by various immunological mechanisms. To tell you in simple words, allergy is an abnormal reaction of the body to a previously encountered allergen either through ingestion, inhalation, injection or skin contact, often manifested by itchy eyes, running nose, wheezing, skin rash or diarrhea. This allergy is caused by various allergens. What are these allergens? Allergens are non-parasite antigens that can stimulate a type of reaction called as type 1 hypersensitivity reaction. In normal individuals, IgE antibody is present, but in allergic individuals, this IgE antibody will be on the higher side. So when allergens do come in contact with the allergic individuals, they go and bind to this IgE antibodies and they trigger degranulation of chemical mediators from mast cells, which are responsible for all the allergic symptoms. Which are the more common allergens we do come across in day-to-day life? Especially the food allergens. There are various food allergens like nuts, especially groundnut, cashew nut and so on and so forth. Seafood, eggs, peas, beans, milk, etc. There are few insect products which do cause allergies like bee venom, wasp venom, ant venom, cockroach calyx, the dust mites and few mold spores also cause allergies. And most of us have pets at home, especially dogs and cats. Their hair as well as dander are responsible for allergic symptoms. And few vaccines which contain certain proteins do produce allergic reactions also. And there are various plant pollens in the environment like ryegrass, timothy grass, especially parthenium. All these pollens are responsible for various forms of allergies. And coming to the drugs, there are few group of drugs which are responsible for allergies like penicillin group of drugs, sulfonamides, local anesthetics and salicylates, especially when you're given a painkiller. People come with rash and allergies most often to a clinic. So these are the commonest allergens we do come across in our day-to-day life. When do you suspect allergy? If an individual has come with repeated urticarial skin rashes, persistent cough, spasmodic cough, especially with a normal chest radiograph, then you have to suspect allergy. Apart from that, when a person has running nose, repeated sneezing, repeated upper respiratory tract infections, non-resolving sinusitis, nasal infections, pharyngitis, or even nasal polyps, you can raise a suspicion of allergy in such individuals. When you see repeated angioedema, angioedema meaning there will be swollen lips, swelling of face, etc. And anaphylaxis. Anaphylaxis is a condition where you get skin rashes or your body is swollen, face is swollen, you have breathing difficulty, you have choking sensation, you land up in emergencies where you have to be given injections intravenously. So anaphylaxis like presentation also might be due to allergies. When you have unexplainable diarrhea, especially with the bloating sensation and crampy abdominal pain after ingestion of a specified food, then definitely it could be a food allergen which is triggering your symptoms. And repeated infections in children should always raise a suspicion of allergy. And when there is unexplainable presentations, especially after exposure to a specific environment, you can always have a suspicion for allergy. How do you evaluate a patient with allergic diathesis? When a patient walks into your clinic with allergy, A detailed clinical history of the patient will help in obtaining more details about the disease, which should include initial onset of symptoms, probable time of exposure and the development of allergic response, and other related information which might help in planning diagnostic and management and preventive strategies. The physical examination of the patient with suspected allergic disease should include a complete general physical examination, including the organ systems which are pertinent to the complaints of the patient, as well as other probable organs that might be involved in allergies. What are the various presentations of allergies? Now, when the allergy affects the eyes, you might have itchy eyes, redness of eyes and watering of eyes. This is called as allergic conjunctivitis. When it affects your nose, when there is nasal block, recurrent sneezing episodes, running nose, it turns out to be allergic rhinitis. When you have frontal headache, heaviness of head with nasal block, you have rhinosinusitis, and itchy throat, throat being congested, throat pain, swallowing difficulty leads to what is called as pharyngitis. You have laryngitis, as well as when the allergies trickle down further into the respiratory system, it turns out to be wheezing, that is called as allergic bronchitis, and when it involves skin with lot of rashes and itching, it is called as atopic dermatitis. Here is a pictorial presentation of various presentations of allergy. The first picture is of dermatitis with skin rashes. The second one is of angioedema with swollen lips. The third one depicts allergic rhinitis, and the fourth one is of allergic conjunctivitis with red eyes. So these are the various presentations where allergy involves multiple organ systems. How do we investigate a patient with allergy? We will ask for a complete blood count, which involves eosinophils as well as absolute eosinophil count, which might be increased in allergic individuals. Apart from that, inflammatory parameters like ESR and CRP as well as serum creatinine is also checked. I already told you allergic individuals are prone to have high levels of IgE antibodies. Hence, IgE levels are also checked in suspicion of allergic individuals. Apart from this, we check for what is called as anti-nuclear antibody, that is ANA, just to rule out any other autoimmune involvement, because especially skin rashes, urticarial rashes, we have vague presentations which might not be simple allergy, but it turns out to be something else, that is autoimmune disorders. Apart from that, complement levels, that is C3, C4 levels are also asked to assess the immune system. And a urine routine is required just to rule out if at all any sediments are present, so that vasculitis also is ruled out. When all these tests are done and IgE levels are high, we proceed with what is called as an allergy panel. What is this allergy panel? Allergy panel is of two types. One is skin prick test and the other one is food and inhalant panel. As you are seeing in this picture, here you are seeing a forearm of a patient which has been injected with various allergens, and you wait for a reaction to label it as positive or negative reaction, and that is how you find out which allergen is causing allergy in that specific individual. This particular test has its own issues, like you have to prick multiple times and the patient is scared of so many pricks, and innumerable allergens have to be tested by a skin prick. So hence, if that has to be not done, you can go for something called as food and inhalant panel, a blood test which also contains food allergens and inhalant allergens in the panel, which are checked in blood, and accordingly it can be treated. Now, if you find any specific allergen in food panel, best is to avoid that specific food allergen, and most of your problems will be solved. Apart from that, if in inhalant panel, you find allergens which are avoidable, especially like animal danders, like cat or dog dander. If you have pets, especially cats or dogs, then you can avoid them. Apart from these avoidable inhalant allergens, if you have non avoidable allergens in the inhalant panel like house dust mite or parthenium or grass pollens or all those things, then you go for something called as immunotherapy. This is just a picture to make you more aware about the symptoms, how it progresses in allergies. This says stop sneezing before it becomes wheezing. When you have repeated sneezing episodes, recurrent nasal block, over the period of time, it might trickle down further into the respiratory tract and it might turn out to be wheezing or allergic bronchitis. Allergic rhinitis may turn out to allergic bronchitis. So we have to stop this allergic march before it progresses further. To tell you more about treatment in allergies, we have antihistamines as the first line of treatment. We have various generations, first, second and third generation antihistamines, which can be given orally in the form of tablets or parenterally in the form of injections, or few ointments can be applied topically. Then comes steroids, which form the mainstay of treatment in case of emergencies. We have other anti-allergic medications like chromoglycate and leukotriene inhibitors like montelukast also, which forms the mainstay in treating allergies. And in allergic individuals who present with pains and aches, especially sinusitis with headaches, pharyngitis with throat pain, NSAIDs do have the role to play, and in such individuals painkillers are also advised. Apart from that, if you spot out a specific allergen in the allergy panel which can be treated by immunotherapy, yes, immunotherapy is also important and it also forms the mainstay in treating allergies. In certain individuals where allergies do not come down easily, there might be a need for immunomodulators and immunosuppressants, especially in urticarias. And we have newer generation drugs like biologics, which are anti-IgE therapies, example omalizumab, which has proven to be very good in treatment of asthma especially. And apart from all these, we have to avoid the allergen. If at all you can spot out the allergen, the best is avoidance of allergen, and then you're off with all your allergic symptoms. And definitely your lifestyle modifications do help in bringing down the allergies. So to make you more aware about immunotherapy, what is this immunotherapy? It is the technique of treating IgE mediated disease with increasing doses of allergen to decrease the sensitivity to that specific allergen. Whatever the individual is sensitive to, we are trying to desensitize that particular individual in the form of immunotherapy. It can be done in two ways, skid therapy or slit therapy. Skid therapy is called as subcutaneous immunotherapy, where injections have to be injected in the subcutaneous plane, that is below the skin, like insulin injections. This is little painful procedure and it has to be taken repeatedly. Hence, the other form of treatment is more feasible, like sublingual immunotherapy. It is called as slit therapy, where the allergen which is prepared is given in the form of drops, which has to be used below the tongue. To conclude, allergy is a disease mediated by hypersensitive immunological response to an external agent, which are often proteins or other chemical products. The clinical presentation of allergy may vary depending upon the organs involved, and the disease mechanism mainly involves mast cell degranulation, contributing to the secretion of histamine and other chemical substances which are responsible for the clinical manifestations of allergy. And allergies of various clinical forms affect more than 30 to 50% of population at any given point of time. So with this talk, I hope I have made one and all more aware about allergy, and in case if anyone has any of the allergic symptoms, please do investigate yourself, visit your doctor and get treated yourself for allergies. Thank you one and all.